Hello everyone, I am Sarun Jose, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore, and today we are going to discuss the topic about first pass metabolism from the pharmacology. So first we want to know what is first pass metabolism, where it's come to the process. Okay, so first pass metabolism is also known as first pass effect or the pre-systemic metabolism. So first pass metabolism is also known as first pass effect or the pre-systemic metabolism. So in some type of university questions or question paper, they ask what is first pass effect or pre-systemic metabolism, they asked. So that is nothing, that is also known as first pass metabolism. So this paragraph is a definition of the first pass metabolism. So I am going to read, so you can listen carefully. Okay, so first pass metabolism refers to the process by which the drug is metabolized before it reaches into the systemic circulation. So this is the one of the important point. So the first pass metabolism means that refers to the drug by which is metabolized before it reaches into the systemic circulation. So before it reaches the systemic circulation, the process is known as the first pass metabolism. This phenomenon is primarily occurred due to the when the drug is administered orally. So the first pass metabolism is commonly occur in the oral route. So if we take the drug in the intravenous route, there is no first pass metabolism is going to happen. Only happen when we are taken into the oral route. Okay. So after absorption from the intestinal tract, the drug enter into the portal vein. After drug enter into the stomach and absorbed, it directly enter into the portal vein, and it is transported to the liver, where a significant portion of the drug is metabolized by the hepatic enzyme before it enter into the bloodstream. Okay, as a result, the amount of unchanged drug is available to produce the therapeutic effect. So whenever they can ask the what is first pass metabolism, you should write this 7 line. Okay, 1, 2, 3, 4, 5, 6, 7. This 7 line is a definition of the first pass metabolism. Here is a image visual representation to represent the first pass metabolism. Okay, I am going to explain. For example, in first they are divided into 5 steps. In first step, oral administration. I already tell. Then the first pass metabolism only occur when we take the drug in the oral route. So when we take the drug in oral route, it enter into the stomach and which passed through the intestine. So intestine there is a vein which is known as portal vein, which is also known as hepatic portal vein, because it is directly connected from the intestine to the liver. So that is known as hepatic portal vein. Okay, through the hepatic portal vein, the absorbed drugs are enter into the liver. So here the liver is a major organ which conduct the first pass metabolism. The liver is also known as metabolic organ or biotransformation. Metabolism is also known as biotransformation reaction. Okay, so there is an enzyme which help to break down the drug. Okay, if the drug is break down, which excreted through the kidney, if drug is in the original form, unchanged form, which enter into the bloodstream or systemic circulation to produce the therapeutic effect. Okay, here is the visual representation. I previous slide explained the same concept. When our drug is taken the oral route, which enter into the stomach and intestine. In intestine there is a small mucosa which is known as villi. Through that villi, the drug is a villi. Through this villi, the drug is absorbed and enter the portal vein. Through the portal vein, it enter into the liver and then enter into the systemic circulation. It is the same concept how the metabolism is happen. Here is the clinical examples of the metabolism. So first pass metabolism is significantly clinical impact because it markedly reduces the bioavailability. If the drug has high first pass metabolism, the bioavailability of the drug is decreased. Okay, so bioavailability of the drug is directly proportional to the first pass metabolism. Bioavailability refers to the fraction of the drug administered dose and that reach the systemic circulation in the unchanged form. So how much amount of fraction of the drug is administered and how much amount of drug is absorbed and it's entered in the systemic circulation. So that is known as bioavailability. If the drug have 50% bioavailability, which means the 100 mg of drug is taken and only the 50 mg of drug which enter into the systemic circulation. So the bioavailability is 50%. Okay, then the significance, if the drug with the extensive first pass metabolism which has poor oral effectiveness. So the drug has high first pass metabolism, then the drug cannot be given in the oral route. Okay. So first pass metabolism is markedly reduced by bioavailability. We already see that. Okay, there is an alternative route for first pass metabolism. What are the alternative route? If the drug has high metabolism, what are the alternative route? We already see the IV route can be preferred because it does not enter in the liver. So sublingual route. So sublingual route is preferred for first pass metabolism, which means under the tongue or buccal cavity there is a small pores which absorb the drug and which directly enter into the systemic circulation. So example, nitroglycerin. If the person have angina, we can give nitroglycerin under the tongue. So it does not enter in the liver for metabolism. And transdermal patches. So transdermal patches will directly enter in the systemic circulation, which cannot go the liver. Example, phenetidyl. And intravenous, we understand intravenous injections are directly enter the systemic circulation. And rectal route. So rectal route which bypass the liver. So we can use the diazepam and chlorpheniramine. This was antipsychotic drugs can be also given the rectal route. Okay, next inhalation route. Inhalation route is nothing, the salbutamol like bronchoconstriction, bronchodilation. So that type of drugs can be also given in this inhalation route, which cannot enter into the liver. Okay, these are the basic concepts about the first pass metabolism and their significance and their alternatives, how to overcome the first pass metabolism. So today we are seeing about this concept, and thank you for watching video. Have a great day.